how have y'all been kind of using AI within your business? One of the questions I like to ask is, if there was a magic wand you could shake and AI could automate something or solve something for you, what would that thing be?
Part of the important treatment for almost all patients with back joint pain, right, is exercise and physical therapy. So on our platform, our physical therapist will prescribe the patient a home exercise program, just like every physical therapist does.
Sure.
And so our patients can log into the platform and then use our sensorless motion guide system, which is basically computer tracking. So any device that has a camera, their laptop, their cell phone, right? They can log in to do their exercises where there's an avatar that's showing them, okay, Mary, here's your 5 exercises and you're going to do, I'll say, a squat. And you're supposed to do 2 sets of 10. And I'm doing the squat in front of my camera, my laptop, and the program is counting the number of reps that I do and giving me AI generated feedback on the quality of the exercises that I'm
No
doing.
way.
So am
Wow.
I squatting low enough? Am I squatting too low? Live feedback to help me as the patient improve the quality of my exercises.
Welcome back, everyone, to another episode of the Big Hitters Podcast. I am here with Mary O'Connor. She is a part of VORI Health, and we're so excited to chat today. Mary, thanks so much for joining the show.
Delighted to be with you.
Awesome. Well, Mary, if you don't mind, maybe give our audience just a little bit of your background and kind of how you landed where you are today with VORI Health.
So I'm an orthopedic surgeon, and I did my residency and fellowship at Mayo Clinic Rochester, and then went on staff at Mayo Clinic Florida, and had lots of leadership roles at Mayo, and love Mayo and putting the needs of the patient first, and leadership positions both at the Florida campus and across the enterprise. And then I retired from Mayo in 2015 when I was recruited to go to Yale to build an integrated musculoskeletal center. And why do I feel that providing a different approach to the care of patients with musculoskeletal, which means orthopedic and spine conditions, right, for people that aren't as familiar with that term? Because we're just not giving enough patients the right care consistently. And when we're not giving them the right care, we're driving up inappropriate surgeries that actually aren't helping patients and cost a lot of money. And it's not just about the cost, it puts the patient at risk of a complication after surgery. And we're not seeing patients kind of as the whole people that they are. Particularly in orthopedics and spine, there's a huge overlap with MSK pain, depression, anxiety, sleep disorders, not eating well, obesity. And so all of these other factors really come into play on exacerbating that knee pain, back pain, whatever pain it is that you have, and are important as part of our toolbox for the treatments that we can utilize to help you get better. And for most patients, they can get better without surgery. Now, we at VORI Health, we are not anti-surgery, okay? I'm a co-founder, the other co-founder, Ryan Grant's a spine neurosurgeon. So we know that surgery can be absolutely the right treatment for some patients. But for a lot of patients, they can get better without an operation. But in our traditional system, that great non-surgical care that is multidisciplinary and focused more on the whole patient doesn't really happen. So that's why we said, okay, we're going to go co-found VORI Health and do this startup, and I'm going to leave the comfort and security of academia, and I'll leave Yale and go be entrepreneurial and and do it.
Oh my goodness, that's so exciting. I love the model and the vision. It's funny. I should have mentioned this off air, but my wife is actually a physician assistant and she works in orthopedics. So as you're talking about some of this stuff, I'm like, yeah, this is so interesting. I love it.
Yeah.
We live here in Denver. She's with UC Health for CU. So she works under a guy named Dr. Gennario. But it's so fun. She loves her job. So
Yeah, that's good.
um, that's awesome. Well, yeah. So maybe tell us a little bit about how that has been going. So how long has VORI been around now, and what have been, maybe some of the struggles y'all have seen, and what are some other things that have gone well?
So we started in 2021, and one thing that's amazing about the startup world is that, unlike more traditional medicine,
Hmm.
you get to make changes much more quickly, and you have to make changes more quickly, right?
Totally.
Because in the startup world, you've got to move towards success more quickly. And we've gone through different versions, tweaks on our clinical care delivery model,
Sure.
and evolved from the first visit being first with the health coach, and then with the doc, and then with the physical therapist, to a model where we will do clinical triage of the patient if you're more complicated, if you've had prior surgery,
Sure.
depending if you have more pain, if your functional level's worse. Then you go into our integrated visit. I'll get to that in a moment. And if you're less complicated, you can start with our physical therapist and then get escalated to the physician if need be.
Mm. Hmm.
And in our integrated visit, which we've again evolved, that is a video visit where both the doctor and the physical therapist are together with the patient in the same video visit. And that is very innovative and has
Mm.
been wildly successful for us, not just in terms of our clinicians loving it, but patients loving it. And we did a survey study and we published on that. And probably the finding of that survey study that was most rewarding to me was, 92% of patients feeling that they understood their health condition and
Hmm.
how to start treatment better than what they think they would have uh, had
Wow.
achieved in the traditional setting, which speaks to health literacy, right?
Yeah.
If we as patients don't understand what the problem is and how to treat it, then how can we expect anybody to make progress? So
Totally.
so in that integrated visit, right, the patient only has to tell one story. It's one history, and the doc and the PT can both ask questions. It's one virtual physical exam. The doc renders the medical diagnosis, the physical therapist the functional diagnosis. The care plan between the doc and the PT is created right then and there. There is no miscommunication. The
Wow.
communication is happening live. The
Yeah.
patient understands that their VORI doctor and their VORI physical therapist are on the same page.
I love that.
And in the traditional world, that just doesn't happen. I mean,
Yeah.
surgeons and doctors and physical therapists rarely actually discuss a patient.
Yeah. Yeah. That is so true. Yes. Because usually it's like, well, I've got someone I can kind of refer you to, but the communication between the two of them typically doesn't happen because there's probably just not enough time, and there's not a good enough system kind of implemented to make that work.
Correct. That's absolutely correct. So we structured the process, right? This is about the way you systematically create a process that is
Mm,
going to promote effective collaboration between your different clinicians to the benefit of the patient.
absolutely. Wow. Okay, I love that.
Yeah.
Well, this is probably a good transition then, because I mentioned we were going to talk a little bit about some AI stuff. So obviously, part of what y'all do is virtual meetings, or I guess telehealth,
Yeah.
if you will. So how have y'all been kind of using AI within your business? One of the questions I like to ask is, if there was a magic wand you could shake and AI could automate something or solve something for you, what would that thing be?
Well, let me start with how we currently use it.
Okay.
So part of the important treatment for almost all patients with back, joint pain, right, is exercise and physical therapy.
Mm-hmm.
So on our platform, our physical therapist will prescribe the patient a home exercise program, just like
Mm-hmm.
every physical therapist does.
Sure.
And so our patients can log into the platform and then use our sensorless motion guide system, which is basically computer tracking. So any device that has a camera, their laptop, their cell phone, right?
Mm-hmm.
They can log in to do their exercises where there's an avatar that's showing them, okay, Mary, here's your 5 exercises, and you're going to do, I'll say, a squat, right?
Sure.
And you're supposed to do 2 sets of 10. And I'm doing the squat in front of my camera, my laptop, and the program is counting the number of reps that I do
Mm,
and giving me AI generated feedback on the quality of the exercises that I'm
no
doing.
way.
So, am I
Wow.
squatting low enough? Am I squatting too low? Right? Live feedback to help me as the patient improve the quality of my exercises. Our
Wow.
physical therapist then can see that data, right? And know if I'm actually, am I doing my exercises at home? That's kind of like the first question, right?
Right. Yeah.
Because most people don't do their exercises.
Oh, I know. I just had physical therapy yesterday, and she gave me my plan, and I got home, and I'm like, I don't know if I want to start this, but I'm like, if I want to get better, I've got to follow the plan. So I totally
Yes,
get it.
but it helps people to do it if they know that there's some accountability. In other words, we're going to know if you did it, right? And because the goal is to help you get better. And I don't like the word compliance because, was the patient compliant with their home exercise program?
Yeah.
No, I want the patient to be engaged, right? I want you to understand why it's important that you do your exercises because that's how you're going to improve and that's how you're going to avoid a surgery that that has risk. Like
Yep.
I've done thousands of operations in my career. There is no surgery for which the patient isn't the one carrying the risk, right?
Mm-hmm.
There is no
Totally.
surgeon that the only surgeon that doesn't have postoperative complications is a surgeon who doesn't operate.
Yeah.
So it's part of the deal, right? You have to
Mm-hmm.
weigh the potential benefits of the surgery against the risks.
Mm-hmm.
But if we can help you improve without an operation, isn't that better? Of course it is.
I know. Well, I'd love to hear this, especially from someone like you, because I think right now there's sort of a stigma, maybe in the medical world, where it feels like a lot of people are kind of being pushed to just do things that maybe they don't necessarily need, but they generate a lot of profit, right? And so to
Mhm.
hear someone like
Mhm.
yourself who's like, hey, surgery isn't always the best option or isn't always necessary, and there's could be some alternatives. I mean, that's really awesome to hear. So I'm excited for our audience to gain more exposure to VORI because I think this is so just needed right now.
So here's the fundamental challenge.
Mm-hmm.
All health systems in this country generate their financial margin on elective surgeries, advanced imaging, and procedures.
Mm-hmm.
Everybody does. Okay. Now, they're not evil people, but that's the only way that they can keep the doors open to serve the
Yeah.
community.
Mm-hmm.
Now, so they have to take the profitable service lines like orthopedics, spine, okay, and generate positive financial revenue in order to offset the service lines which will never even break even. Pediatrics, okay, infectious diseases,
Mm-hmm.
things like that. And you need these services in order to care for the population and to run a
Yeah.
hospital, okay? But they're not going to make money, so you have to make money off of the service lines that can be profitable. And
Yeah.
surgery is the main driver.
Yeah. Mm-hmm.
So anything that you do in the system that decreases elective surgery rates will financially hurt the system.
Mm-hmm.
And if you go to any healthcare, I would challenge anyone, if they're being honest, and they look at healthcare systems and surgery departments, if one of the primary metrics isn't surgical volume, because I know it is, right? Everybody wants more surgeries performed because that is so critical to the financial survival of the hospital and healthcare system. And we have to remember, again, I don't paint these people aren't like evil or bad people.
Totally.
These hospitals operate on thin margins,
Hmm.
and that's why, I mean, we're talking 2%, 4%, 5%. Like a for-profit company, they they're not operating at that level of margin,
Right.
right? Orthopedic implant companies, their quarterly margins are in the high teens or low 20s.
Yep.
So it's this huge difference in terms of the ability of hospitals and healthcare systems to stay financially viable, which is why we see a lot of small hospitals closing,
Hmm.
hospitals in rural America, hospitals in the inner city. This is why we see healthcare systems purchasing smaller hospitals to, right, expand their
Hmm.
network because their contracts for payment are going to be more favorable
Hmm.
than what that small hospital was able to negotiate.
Totally.
And that then results in higher healthcare costs overall.
Yeah. Yeah.
Okay. But again, the hospital system is trying to survive.
Yep.
And
Yep.
we need hospitals, right? Just like we need police departments and libraries
Absolutely.
and fire departments, and we don't tend to think of hospitals as essential for communities, which I firmly believe that they are.
Oh, absolutely. It's funny too, because you don't think much about it until you're the one who needs help. And then you're
Oh,
like, well, the hospital is actually extremely important. And so, yeah, it's
not
just,
yeah, not only that you need help, but you want to get help at a place where there's great doctors
hmm,
and great service and they know what they're doing, right?
yeah,
And I mean, that's the difference. That's the difference between if you having a stroke, whether you're going to have permanent paralysis or neurologic impairment or speech impairment,
totally.
right? I mean, these are very important. These can have very substantial impacts to patients. When you need a hospital, you really need a hospital. And
Yeah.
so we need hospitals to be healthy and thriving. The
Hmm.
problem is the way the payment system is set up promotes, in my opinion, high utilization of surgery, which drives inappropriate surgeries.
Yeah. Yeah. Exactly. Man.
And
Oh, so
let
much
me
we
do
could
one
cover
more
there.
clarifying comment on that.
Sure.
I don't think the surgeons, my surgical colleagues, are bad people. I don't think they're
Totally.
operating
I
on
don't hear that at all,
operate
just so you know. Yeah,
right.
totally.
But when you think of a patient who has the question of is surgery the right treatment? There's three groups. There's the group of patients that everybody says this patient is not a surgical candidate. Okay. Then there's the group where everyone says absolutely this is an appropriate patient for surgery. And
Hmm.
then you have all these people in the middle, this gray zone where judgment comes in and
Yeah.
where we at VORI Health have the opportunity to impact the trajectory of that patient by saying, hey, let's make sure you really have good non surgical care first. And you know what? If you're not getting better, we're happy to send you to the surgeon. But we
Totally.
know for these people in the middle that we can help them, a lot of them, most of them actually,
Hmm.
get better without the risk of surgery.
Oh, I love that. That's so cool. Yeah, this is so fun to talk about. Maybe if you don't mind sharing as well, I'm always so interested, especially for someone with your story who ended up kind of becoming a part of a startup a little bit later into your career. What has what are some challenges that have came with that? As going from being a surgeon to all of a sudden now you're a founder of a startup. What have been some of the struggles or challenges that have come with that?
Um, well, startups are inherently challenging.
Mm-hmm.
And I would say that on the business side, as with many startup companies in the medical space, it's conversion of members for which we have covered lives. So we have contracts and we focus on value-based payment contracts.
Mm-hmm.
Um, we don't do fee for service payments for those that are familiar with that, because that really doesn't support our biopsychosocial model, because no one
Mm-hmm.
wants to pay for a health coach. No one wants to pay for the patient to see a registered dietitian if they have more significant nutritional needs, right?
Totally.
In our model, we want to do a value-based payment model. So our care teams can include those clinicians that I know will be helpful to you in your journey.
Yeah.
Okay. So that's one fundamental difference. But getting those patients for which are covered lives, yes, we have contracts, right? Getting them to be to know us, to engage with us, to use our services. Everybody has this challenge of, engagement, basically driving consumer awareness,
Yeah.
and yeah. And then once
Yeah.
we have them, it's good.
Mm-hmm.
Once the patients interact with us, we have just wonderful patient stories. You really listened. I'm really delighted with my care. And of course, that's very rewarding.
Totally. Yeah. Um, yeah, I'm just thinking through. So what are y'all doing currently now to kind of grow your awareness, or I guess like client acquisition? It sounds like, a lot of people just need to hear about you guys, because someone like me, it's like, I think this is amazing. I just didn't even realize you guys existed. So, what are you guys currently doing for that?
Well, we're we have some partners,
Hmm.
self-insured employers, and we have insurers, big payers that we have contracts with, right? But some of the more innovative things that we're doing to try and get further upstream in the patient journey. Sorry, that's me. One
No, that's
second.
mine actually. I'm
Okay.
turning it off right now. I apologize.
Um, One of the ways that we're working to get further upstream in the patient journey is to um, is for benefit plans to help encourage that patient to see our docs and our team if there's a question as to whether they need advanced imaging, namely like an MRI.
Hmm.
Because the primary care docs, and I love primary care docs, and like they've got this Herculean task in front of them, right? To like know everything and to be able to do everything for the patient. And that, of course, is just not possible.
Totally.
So we really serve as that bridge between the PCP that is not as comfortable treating spine and orthopedic conditions and the surgeons
Hmm.
who tend to overutilize ordering advanced imaging and then overutilize surgery. And why does
Hmm.
that matter? Because MRIs, which is amazing technology, right, show so much, and you can find something to operate on an
Yeah.
MRI.
Hmm.
And we know that in particularly for spine, lots of research on this, that the findings on the MRI oftentimes do not correlate with why the patient has pain.
Totally.
So
Yeah.
you see your primary care doctor, you have back pain, they get the MRI, guess what? You're over like 25. So everybody's like, and there's going to be something on your MRI,
Yeah.
okay?
Totally.
Because we get older, we have age-related changes. I have wrinkles now that I didn't have when I
Hmm.
was younger, okay?
Hmm.
Does that mean I need a facelift? Well, I don't think so. But you know what I'm
Hmm.
saying? Like there's a
Totally.
difference here. So getting upstream and saying, let us evaluate that patient first. If we think they need an MRI based on clinical evidence-based criteria, then we're going to order it and there will be no copay to that
Hmm.
member.
Hmm.
No out-of-pocket cost for that member if they come through us.
Hmm.
Now that gives us an opportunity to deliver evidence-based care to that member who becomes our patient and to help save cost for the payer, the self-insured employer. It's like
Hmm.
win-win, huge win.
Hmm. Absolutely. Wow, that's so cool. I love that. And maybe speak on, we can kind of wrap up with a few more questions here, but would love to know for you, because sounds like you were obviously a surgeon, and so I can imagine what your day to day looked like. But what does your typical day sort of look like now, and what are you kind of putting most of your time and energy toward?
Uh, well, that's a great question. And, I think I actually work as hard now as I've ever worked. I just do different work, right?
Hmm.
So, I'm on Zoom like most days, like
Yeah,
most of the day, or doing other work. And um, again, uh, what excites me is like this is my passion, right? To really try and transform the delivery of MSK care,
yeah,
because because I've done all the other stuff in my career like I aspired to achieve. So
totally.
I don't have a lot more boxes to check off.
Hmm.
Full professor, president of many professionals. Like I've had a lot of gratifying professional success.
Yeah.
And so now, like I want this to be my legacy that I
Hmm.
am really helping to change medicine for the better because the best solutions will come from the clinicians who are delivering care,
Yeah.
not, and I say this with all due respect, not the bean counters and the MBAs that don't understand what it is to treat a patient.
Hmm.
So, and we need them too, don't get me wrong, okay? But if they're the ones that are creating the programs to drive the change, I I worry that those programs won't be patient-centered and delivering the kind of care that I would want for me or my family.
Hmm. Yeah, I love that. That's so good. And are you? So it sounds like you kind of go from surgery. You're probably doing a lot more, meetings, admin type stuff. Do you
Yeah.
have any kind of like an assistant that helps you out with some of that stuff, or what's kind of your staff team looking like? I guess how many people do you employ there at VORI?
Um, well, we have quite a few clinicians. I won't put the exact number, and I'd have to kind of do a calculation in
Oh,
my
you're
head.
fine. Yeah, we don't need
Yeah,
exact. I was
yeah.
just curious to give our
But
audience a size.
my main team is my clinical leads, so my lead physician and physical therapist and health coach, and that's kind of the core group for me in terms of driving change and programs through the clinical practice. And
Sure.
then I have our clinical administrator, who's kind of like my right hand woman. She's amazing. And then our C suite, our executive leadership team. That's kind of my first team. We're really all in this together, and we need each other to bring the skills and perspectives so that we can deliver better patient care in a viable business manner,
Hmm.
right? Because like if we can't make the business successful, we can't help anyone.
Totally.
So my favorite Mayo Clinic quote is from the last nun who ran St. Mary's Hospital in Rochester, Minnesota, Sister Jenna Rose.
Hmm.
And her famous quote is no margin, no mission, right?
Mm.
If you can't make money, if you can't make a margin, you can't support your mission.
Yeah.
But the second part of her quote, which people don't always include, is no mission, no need for margin.
Mm.
And healthcare is different than other businesses because if we're not devoted to our mission of serving patients in our communities, then we have no business trying to make a margin, trying to
Yeah.
make money to stay open. We are
Yep.
not like that's the fundamental difference between a business that sells a product for
Hmm.
profit and healthcare.
Absolutely.
Yeah.
Yeah. That's so good. I love that too because typical business, I mean, you're probably buying something that more than likely you kind of want, whereas healthcare is typically on a needs basis. And so, when someone actually needs something, there can often be, higher prices or kind of more manipulated prices because they know, well, these people need this, and your health is a very like, people take that seriously. And once you're not healthy, then you realize how much you appreciated your health to begin with.
Yeah.
So,
And medical debt is probably I think it's actually the leading cause
I've
of,
heard that. Yeah.
yes, of financial stress.
Yes.
And that's the last thing you need when you or your loved one is sick. Yeah, it's very, as we know, the healthcare insurance and landscape is very complicated.
Yeah. Absolutely. Well, this has been so fun, Mary. Maybe you can stick around for a few more minutes when we're done here, and we'll chat a little bit more. But yeah, want to respect your time. So I've been asking every business owner this and been writing down their answers. But if you had maybe a piece of advice for a young man or woman in their 20s, kind of starting off their career and thinking about starting a company, what would be sort of a piece of advice or a thought that you would want
Mm,
to leave them with?
that's a great question. And I oftentimes, there's a lot of young doctors that will reach out to me that have, kind of entrepreneurial aspirations. And one of the things that I say, which probably doesn't sound very sexy, but I think is very important, is get your personal finances in order. Like,
Mm,
don't go into a lot of debt. Like,
hmm.
try to be out of debt.
Yeah,
Because if you are not in debt, then you have much more personal freedom to make professional career decisions and
yeah,
choices that you otherwise wouldn't be able to make. Right? When
yeah,
I went from being a surgeon and getting paid an awful lot more, I mean, generating a lot more income than I do
yeah.
in the startup world, right?
Hmm.
That would have been very challenging for me and my family financially if I had lots of debt. But the house was paid off, the cars were paid off, the college fund was secure. Like, my husband and I have been very thoughtful in kind of the financial planning. And so
Totally.
I say this to anybody, right? Like, try to be very cautious and conservative in your own financial life, because
Hmm.
the more financial freedom you have, the more freedom you have for career decisions.
Mm-hmm. It's
Because you
so
can take the
true.
risk, right? You can take the risk
Yep.
to follow your passion and say, you know what? I'm going to go do this. I'm
Yep.
going to go do this startup. This is my passion. I am going to live my vision and my values, and I'm going to go do it. And I can do it because my financial obligations to my family, I'm okay. I'm still
Yep.
okay.
I love that. It makes me think of I know there's a proverb that's the borrower is the slave to the lender, and it's just so true. I mean, if you're bogged down with debt, I mean, you're just not going to be able to make any moves until you get out of
Yes,
that, you know?
right,
So it's interesting you bring that up because it makes me think too with healthcare costs, but then also just the cost of education. I mean, I can't blame some of these young guys and girls that are like, I don't even know if I'm going to go to college because it's like it's an arm and a leg just to get your undergrad, and then you got to do graduate school and a residency, and it's by the time you're done, I mean, you're making great money, but with taxes and the debt you owe, I mean, you're making like an entry level salary, and so it's yeah, it's a problem that I hope we can solve soon. So.
well, fortunately, there are now some medical schools that are tuition free,
Mhm.
and that's a great thing. Yes, I had tremendous debt when I came out of my residency and fellowship,
Mhm.
and really focused in the first couple years that I had, my first, my real job at Mayo Clinic, on
Mhm.
paying off those loans. And I mean, that was a time when I had interest rates for HEAL loans that were, like 9, 10%. I mean, it was ugly.
Yeah.
It was ugly, right?
Yeah.
And like, very focused on, let's get out of debt. We're not going to do the work on the house that we want until we can get out of debt. Like, you got to get out of this and then start building up, I'll call it your financial security,
Yeah.
because then you have the freedom to make other choices.
Yeah. Totally. It's so funny. My wife and I are in this exact same boat now. So to give you more context, I'm 29 and she's 27, but she graduated about a year ago and has an awesome job that she loves. we've obviously got a lot of student loans from her from her school,
Yeah.
but we both have kind of said the same thing. We're like, there's so many house projects we want to do and different things, but we've just been like, you know what? We've just got to live below our means, and we've got to be content for a while until we can get some of this debt paid off, and then that will free us up. But it
Mhm.
is so tempting because you want the nice car and you want to remodel the house and you want to keep up with your friends, and um, there's so many things in the world pulling at your finances. So
Yeah, but well, first of all, kudos because
mhm.
I wholeheartedly think you have the right approach to this because you will just be so much better off and have less financial pressure and stress down the road,
Yeah,
right? Yeah.
totally.
So
Yeah.
it's
Well, I
wonderful.
appreciate that,
Congratulations.
Mary. Yeah, thank you for saying that. Like I said, this was so fun for me. Maybe we can chat a little bit after, but really appreciate all of the insights, and it's been so fun hearing about VORI, and hopefully our entire audience will get to learn a little bit about you guys. So thanks so much for coming on,
Well,
Mary.
my pleasure. Appreciate the opportunity, and everyone have a wonderful day and week.